Hi, it's Dr. Miller here from Rhinoplasty New York, and I want to talk today about the top 7 things you should know before you undergo a rhinoplasty. The first thing is the types of rhinoplasty. 2 topics about that. One of them is open versus closed, and another way to phrase that is the open is often called external, and the closed is often called endonasal. And what that involves is simply what incisions are made and what approach does the surgeon make in order to perform the rhinoplasty. An endonasal or a closed, the incisions are being made only on the inside of the nostrils. There's no connection down here along what's called the columella, and the cartilages are either viewed sort of up underneath the skin. The way I like to sort of say it is, imagine a ball that is underneath your sheets in your bed, and in order for you to get that ball, you have to sort of go to the bottom of the bed and sort of go underneath the fitted sheets and underneath the tucked in sheets, and then sort of come up and around and then get the ball and go back out in that sort of awkward direction. So that's what closed or endonasal rhinoplasty is, and the approach to the structures of the nose, as opposed to external rhinoplasty. And external rhinoplasty gives you a much better exposure. A good example of that would be same ball under the sheets, but you just take the sheets and you pull them down, and there's what you need to operate on or work on, and then you just pull the sheets back up again. There is advantages and disadvantages beyond the scope of this video for both. I think it's important for you to go most of all to an experienced rhinoplasty surgeon who is skilled in both and who chooses one or the other depending upon which one is best for you. I also want to talk about ethnic rhinoplasty because we hear that term all the time, and I just want to say I think it's ridiculous, okay? And the reason is that my rhinoplasty colleagues who are in South America, right, their ethnic rhinoplasties mean operating on Caucasians, right? And my colleagues who are out in Japan, right, their ethnic rhinoplasty means they're operating on Caucasians. So when we say here ethnic rhinoplasty in America, we're referring to operating on typically your Latino, Hispanic, your Afro-American, your Asian, etc. But keep in mind that the term really doesn't mean anything other than one's skill set across the entire ethnic domain, because the term doesn't really exclude Caucasians when you start going over to South America, or over to Asia or Europe for that matter. So that's what ethnic rhinoplasty is, if you ever hear about that. Now, who specializes in rhinoplasty? And I have to be careful about this. There are 2 specialties within the medical field that do this. You have plastic surgeons who are trained to operate all over the body, and then you have facial plastic surgeons who have dedicated their career to operating only on the face. So one would say, trust your face to a specialist. And quite frankly, having come from that background, that's what I would strongly say. But that being said, in the rhinoplasty community, and it is not a very large community, there are plenty of plastic surgeons who have dedicated their career to rhinoplasty and are really good. So I would say what's more important is absolutely look at their training, absolutely look at their board certification, but look at their passion and their dedication and their commitment, and see whether or not they have committed their practice to performing not just an occasional rhinoplasty once a month or even 3 a month. Okay, that's not enough. You want to know that there are 3, 4, 5 rhinoplasties a week being performed by that surgeon. That's what's most important. That's what it is. Because rhinoplasty is the most difficult operation there is because of all of the variabilities. I equate rhinoplasty with chess. I make a move, your nose responds. I make a different move, your nose responds. And believe it or not, the same looking nose will respond differently based on the two different individuals that I'm operating on, which is of course why I love rhinoplasty, because it's as much, believe it or not, intellectually challenging and it is as it is an art form. Is it painful? No, it really isn't. I think that it's uncomfortable. The days when it used to be really painful were when the nose used to be packed, but we don't do that anymore. So it's typically not painful, it's just uncomfortable, like a really bad cold for maybe a week or so. What's the biggest regret that people have who underwent rhinoplasty? I see a lot of patients who are requesting revision that have been operated elsewhere, and I would say the number one regret that they have is not having a good communication relationship with their physician. And probably number two is the other thing they say is that they didn't do their research and they didn't find that doctor who is really, really committed to rhinoplasty, who has a lot of rhinoplasty experience. But when I say communication, I mean it's so important. Ultimately, sadly they blame themselves and they say, you know what, I just didn't convey what I wanted properly to the surgeon. And to that I say, well, actually, that's the surgeon's responsibility. The surgeon's responsibility is to make sure that you do convey that to them. I see patients from all around the world. I'm honored to have that practice, and so I see a number of patients first on Skype, and then I won't see them the next time until maybe the day before the surgery, so that we talk, and then they have the surgery. And I had this one patient who, on the morning, I had seen her a number of times, I think maybe once or twice on Skype, and then she came in and I could tell that she was a little flustered, and I said, what's the matter? And she said, well, I read everywhere that you really shouldn't have the surgery unless you've had enough face time with your surgeon. And I said, okay. And she said, well, so I don't know whether or not I've had enough face time with you. And I said, well, first of all, no rush, because we'll take as much time as we want before we bring you back to the operating room, and we may not even choose after our discussion to do the surgery. But here's how I sort of summarize it. If you feel that you properly conveyed what it is that you want, you really feel like you've conveyed that, but more importantly, you have complete faith that I have heard it and that I really know what it is that you want, that's the criteria. That's what matters. And if you don't feel that way, whether or not you spent 20 minutes with me or 2 hours with me or 2 weeks with me, don't do the surgery. She smiled. She said, yeah, I think you got it. And we went into the operating room. So that's probably the number one regret patients have, that they didn't find, or number two biggest regrets. They didn't find, they feel guilty that they didn't do all the proper research and get the right person, or that they didn't spend enough time communicating with the doctor, or maybe were intimidated by the doctor and didn't feel as if their needs, their desires, their wants were properly conveyed. Interesting question. Why is there such a range in rhinoplasty pricing? Well, first one is economics 101, right? Different markets are going to be more expensive. There's no doubt. New York City, Beverly Hills, maybe Dallas, they're going to be more expensive than other markets, simply because of the associated costs that take. I mean, that's just economics, right? But besides that, and I think what plays much bigger role is experience. And those doctors who have the experience and who therefore can more reliably give you a consistently good result are going to, and perhaps deservingly, get or be able to charge a higher price. That doesn't mean that a higher price guarantees you a result, but it definitely influences the surgeon's justification for charging a little bit more. Will my breathing improve? And the answer is, it depends upon whether or not your breathing was bad in the first place. Patients who come to me and, the classic deviated nasal septum, my septum is deviated. If you've never heard that, that means a partition between the right and the left nostril isn't perfectly in the midline. It's a little off to the right or to the left. And I see that all the time, and if the patient doesn't complain of nasal obstruction, I don't treat it. How can you improve upon something which isn't causing a problem? So if you don't have any difficulty breathing, then no, typically your breathing won't improve. If you do have difficulty breathing, then that should be part of your assessment, part of your workup, and part of your treatment. And what's the recovery time? You wear a cast and a tape and sutures for approximately 1 week. The tape and the sutures come out after 1 week. The sutures are only present if you've had what's called an alar base reduction, which is narrowing here, or if you have had the external rhinoplasty, as I mentioned before, where you'll have some incisions over here. Those come out at the same time the cast comes off, and then I like to say around 85% of the swelling will be gone at around 3 weeks to maybe 3 months or so, but then the remaining phase of recovery is what's called contraction, okay? Contraction takes a good year, and what I like to say is the following, think of a sweater, think of a cotton sweater, right? And you take it and it's really, really wet, right? It's in water and it's really, really thick and it's really wet. And you put it out in the sun and over time it's going to dry, right? But now take that and then throw it in the dryer and heat it up and then pull it out of the dryer, and you're going to see that it shrunk. It wasn't its original size. So the wet sweater to a dry sweater is this swelling part. That takes around 2 or 3 months. But what takes 30 minutes in a dryer takes almost 7 to 8 months on the skin, which is the skin contraction. That's what takes such a long time. And that's why you hear a lot of times people saying, hey, you know what? Just be patient because we're not really seeing the end result. So those are the top 7 things I think you need to know about rhinoplasty. There's a lot more, but those are definitely the top 7. Look forward to hearing your comments and suggestions. Feel free to give us a buzz, and look forward to seeing you here in New York City.